Hi, Dr. Sanchez.
Hi, Irma. How are you?
I'm doing good, and you?
I'm good, good. Just covered up with all these things now. You know, we have to be extra careful. That's why I put the mask so you can see.
That's precisely what I wanted to talk to you about.
Okay.
We see, we already know about the guidelines that we need to do to protect ourselves and others from the COVID-19. But there's people that, even though they're come out positive, they're still going out. What can you tell us about that?
That's a problem. I had one patient today tell me, one of my sisters, he says, is so stubborn. Her husband got it, her kids got it, her cousins got it. They've all been very sick, and she still refuses to use the mask and to take care of herself. Just right now, I saw it just a few minutes ago. And sometimes we believe these are very ignorant people. No, these people are educated. What is the problem? It's called foolishness. People are fools sometimes. They think that it cannot happen to them. But, you know, patients and viewers, please be very careful. It is a very tricky disease. Yes, 80% of people don't get anything. It doesn't affect them that much. I had my banker came today. He said his daughter just had 1 day symptoms and got well. She feels completely normal. She still had to be in quarantine, but completely normal. So, what do I tell these people? You know, you have to be very wise, prudent. Don't be foolish, okay? Because you have to think not only about yourself, but you got to think about the other people. If you get somebody sick and that person has the right chemistry so that virus hits them real hard, you're going to kill them. So that'll be on your conscience. So be very careful. When you go to the store, I use gloves. When I go to the store, H-E-B, buy stuff, use gloves. Because sometimes you shake hands with somebody or you touch a knob. You don't know what you're going to do. And so we don't know everything about the virus. That's the problem. So I tell people, be prudent. Always be on the safe side. It doesn't matter what they say. They also have these things here. Just... You know, these are some of these plastic covers. So if you have somebody sneezing or if you have one of these, you can put it on and at least it protects from people that are sneezing. So people will use a mask underneath, you know, the mouth cover, and then they use this one. Some of my employees do this. People, anytime we see a patient that's going to be at higher risk, we put all that gear on, even more gear. We put another disposable suit on, you know, coat. So just a disposable gown. So please be prudent, okay? Don't be of those people that say, no, I'm not going to get it. I'm strong. Nobody ever has it in my family. I never got sick before. Don't kid yourself. We're losing a lot of people. Okay, my nurse told me this morning, one of my nurses that's here, she lost already 7 relatives. 7. And especially those that had diabetes, that have heart disease, they're all gone now. So don't kid yourself, okay? Don't be a doubter. It happens. Another friend of mine, another doctor, a cardiologist, I called him the other day for a consult. He says, I can't. What do you mean you can't? I have the disease. I'm at home. Him and his partner at home, they both got the disease. So he can't work for 14 days. And if you're in good health, it won't kill you. But what if it does? We don't know, okay? So please be prudent. That's about the best thing I have for today. Be wise, okay? Wise, prudence. Don't be foolish, that's for sure. Thank you.
Thank you, doctor.